So the title of the lecture has changed just slightly. You can read it there, The Recognition of Endocrine Gland Abnormalities in Art by Artists and Surgeons. I have two things to acknowledge. I guess Miguel did that already, that we've written the book, The Remarkables, Endocrine Abnormalities in Art. So it's a little bit of selling our book, I guess. And I also work for Zoma, a consultant of an antibody-making company in Berkeley, California. In 2006, an article in the New York Times reported the benefit to medical students of visiting museums and studying paintings in order to become better observers. This is forward. Yes. Okay. Here we can see students from Mount Sinai Medical Center at the Met with a docent learning about art. At the University of Cincinnati, studies were also conducted concerning the art of observation, impact of family medicine, and art-museum partnership on student education. The conclusion of this and other studies suggested that medical students' examination of paintings positively influenced their clinical skills and made them better observers of the human condition. Presumably, or previously, the former chief of medicine at Johns Hopkins Medical Center, Sir William Osler, wrote, "There is no more difficult art to acquire than the art of observation, and for some men, and today it would be presumably men and women, it is quite difficult to record an observation in brief and plain language." Osler's insistence on the value that is critical to artistic representation as well as to accurate medical diagnosis reflects the strong relationship between science and art. It is a relationship that dates back at least to the Renaissance. Among the possible observations medical students might make at a museum is the appearance of a swollen neck that reveals possible endocrine pathology in the form of an enlarged thyroid gland or a goiter. Here you can see on the right Da Vinci's painting of the Madonna and Child, and on the left, which is Goiter Beautiful, the thyroid gland is rounded out and smooth. And then you see the man grotesque by Da Vinci or Da Vinci's followers with a grotesque goiter. Because of its superficial position, the thyroid gland is the most visible of the endocrine glands when it becomes abnormal. According to most medical historians, the thyroid gland was not apparently recognized by physicians until the Renaissance. Nevertheless, in about 200 AD, Galen observed that the thyroid gland during dissections, he must have observed it since he described 7 of the 12 cranial nerves, as well as the recurrent laryngeal nerve and the superior laryngeal nerve in the pig. Galen is considered by some to be the first experimental neurophysiologist because of the studies of structure and function. It has been reported that Galen cut the recurrent laryngeal nerve in a live pig, thus altering the pig's squeak. When Galen then divided the glossopharyngeal nerve, or superior laryngeal nerve, the pig became silent. Now, this was either because the nerve had a function or the pig didn't want to be cut again. It also demonstrated that speech, or phonation, is controlled by the brain and not the heart. During the Renaissance, a time when the marriage of art and medicine was at its peak, numerous artists and anatomists attempted to depict the thyroid gland in their drawings and illustrations. In 1500, Leonardo da Vinci drew the anatomy of the thyroid gland and thought it was 2 separate glands. They're filling up the empty spaces in the neck. And here you can see the thyroid, you see the tongue on the top, on the right, and then you can see the thyroid gland, which they thought were 2 separate lobes. He apparently planned to publish a book on anatomy with the anatomist Mercantio della Torre, but both he and della Torre died before the book was completed. Like Galen, Leonardo probably dissected mostly pigs and dogs. Dogs, in contrast to humans, do not have a thyroid isthmus joining the 2 thyroid lobes. The fact may explain why Da Vinci interpreted the structure of the thyroid gland and humans as being 2 separate lobes. Despite Leonardo's discoveries and the relative accuracy of scientific drawing, his anatomical drawings were unknown to artists and medical scientists because they disappeared for over 200 years. After his death, the drawings were apparently lost, first in the Ambrosonia Library in Milan, and eventually, and also in the Royal Library at Windsor Castle, where they were procured by the artistic advisor to King Charles I, Thomas Howard, Earl of Arundel. Leonardo generated the intellectual climate that helped make possible the work of the anatomist Andreas Vesalius and others, such as the anatomist and surgeons Ambrose Paré, the chemist Paracelsus. Leonardo stated, "First, I shall do some experiments before I proceed further, because my intention is to cite experience first, and then with reasoning show why such experience is bound to operate in such a way, and this is the true rule by which those who speculate about the efforts of nature must proceed." The example of inductive reasoning illustrates the importance of observation and evidence leading to a viable conclusion. It is a significant departure from the deductive or a priori reasoning of the previous 1,200 years. According to the historian F. Capra, Da Vinci, quote, tested the traditional ideas against his own scientific observations and did not hesitate to modify the old theories when his experiments contradicted them. One advantage that Leonardo had over his predecessors was access to cadavers, which he dissected in the anatomy theater at the University of Pavia near Milan. Until the late 15th century, however, the use of cadavers for dissection by anatomists and artists was forbidden because the authorities saw any attack of Aristotle's science as an attack on the church. The commonly held belief was that the artist was primarily interested in the superficial detail as conveyed by a sensitive life drawing. The anatomist concerned himself or herself with the internal system. Also, before the 16th century, most scholars looked down upon visual matters as purely mechanical, not a concern for the intellect, and they strongly resented the corruption of the text by images. The use of cadavers became possible in 1482 when the faculty at the University of Tübingen asked Pope Sixtus IV for permission to take bodies of legally executed criminals from the place of execution and dissect them according to the medical rules and practices without a special license from the Holy See. The authorities also stipulated that after dissection the bodies would be given proper burial. The work of Da Vinci is mirrored in the anatomical studies drawings by this anatomist Andreas Vesalius, who wrote the Humani Corporis Fabrica at age 28, which was published in 1543. Vesalius was of German extraction but Flemish born. He was a pupil of the conservative humanist and anatomist Jacobus Sylvius from Paris. His studies with Sylvius were interrupted prematurely because of the war between France and Emperor Charles V of Spain. Vesalius returned to Belgium and then moved to Padua to complete his medical studies. Upon graduation from medical school, he became a professor of surgery and anatomy in Padua. According to some historians, Vesalius' seminal work, De Fabrica, was probably mostly illustrated by the artist Stephen van Kalkar and or in collaboration with Vesalius or with other artists trained by Titian. The combined contributions of the artist and the anatomist made De Fabrica, quote, the most important single work of in the history of European anatomy. Many believe that Vesalius made anatomy a living, working science. Although Vesalius was a follower of Galen, he reported many errors in Galen's descriptions, probably because Galen dissected animals rather than humans. Despite his access to human cadavers, however, Vesalius, like Da Vinci, also believed that the thyroid gland had two lobes without an isthmus, and he agreed with other scientists that the function of the thyroid gland was to lubricate the larynx. At this time, the increasing tension between the practice of following tradition or using direct observation discouraged independent and forward thinkers like Vesalius. After being severely criticized by his mentor, Jacobus Sylvius, and by some of his colleagues in Padua, he resigned his position from the faculty in Padua. The direct or indirect influence of Vesalius' anatomy trickled down into the artist studios of the High Renaissance. Italian and Northern European artists were particularly observant of the anatomy of the thyroid gland, and those working in areas of endemic goiter frequently represented diffuse goiters in female figures and disfiguring goiters in both female and male figures. Besides Da Vinci, among the artists who accurately depicted such goiters were Botticelli, Raphael, Piero della Francesca, Artemisi Gentileschi, Caravaggio, Rubens, John Steen, and many others. In the numerous examples my wife Carol and I discuss in our book Remarkables, Endocrine Abnormalities in Art, there are obviously associations between the diffuse goiter in females and the aesthetic values and social attitudes of the periods. In the 16th century saw slow but significant advances in scientific understanding of the thyroid gland. In 1619, Fabricius reported that goiters occur or develop in thyroid glands, and Eustachius was the first to then identify that the thyroid gland actually had a thyroid isthmus, and in 1563 also described for the first time the suprarenal or adrenal glands. Sir Thomas Wharton from St. Thomas's Hospital in London illustrated the thyroid gland in his Adenographia book in 1656 and named it Glandula thyroideus, from the Greek word meaning shield. So he was the first to use the word thyroid for thyroid. He proposed that its function was to round out and beautify the neck, and thus women were given larger thyroid glands than men. It is easy to see the relationship between Wharton's theory and the aestheticizing of the enlarged thyroid gland in paintings of young women. The function of the thyroid was not discovered until 1891, when George Murray from Newcastle upon Tyne and a student of the surgeon Sir Victor Horsley documented the subcutaneous injection of thyroid tissue in glycerin in a 46-year-old woman with profound hypothyroidism, improved her condition, and she apparently remained well with treatment for the next 28 years. Before this time, hypothyroidism was often a lethal disease. 1 year later, in 1892, Edward Fox from Plymouth, England, reported that he could get the same success in treating patients with hypothyroidism using lightly fried thyroid tissue, sheep thyroid gland specifically. These results were the first to support the effectiveness in organotherapy. That's for giving something when it's lacking. Also in the late 19th century, surgeons including Paul Sick, Theodore Coker, and Jacob Reverdine, and others observed that some patients following thyroidectomy developed symptoms of hypothyroidism. As most of you know, Coker received the Nobel Prize in 1909 for helping to recognize that the thyroid gland was necessary for both normal growth and development, and for making, and he was also recognized for making thyroid surgery safe. In 1888, on the cusp of Coker's discovery and eventual breakthrough in the treatment of thyroid disease, two French psychiatrists, J.M. Charcot and Paul Richter, published a book titled Les Démoniaques dans Art, or Psychiatric Disease in Art. In a chapter on Raphael's painting in the Transfiguration, the authors discussed the apparent seizure depicted in the flailing gestures of the boy, who was the centerpiece of the center point of the painting. Assuming that the boy's condition described as lunatic in the biblical story of Matthew 17 was epilepsy, the psychiatrist questioned whether Raphael presented the boy as he actually appeared, or embellished and painted the boy to look worse than he really did. When one examines the painting, which was the last and according to Vasari, the finest work by Raphael, one observes that the boy has a squint, exophthalmos, a goiter, gynecomastia. These are three classic clinical signs of Graves' disease, and in addition, the lunacy demonstrated in the boy's gestures could reflect a rare but possible psychiatric aspect of Graves' disease. In our opinion, Raphael painted the boy precisely as he appeared, inadvertently revealing a constellation of clinical signs of Graves' disease. One could not have guessed about these signs of Graves' disease, and neither Raphael nor the French psychiatrists would have known that they were related. Of interest is that the parent figures in the painting, which are the two immediately adjacent to this boy, also have evidence of thyroid disease with certainly profound eyes and perhaps exophthalmos and goiter. We know that Graves' disease can rarely spontaneously reappear and it can occur in families. So this is kind of interesting. Whatever the diagnosis, the boy's condition, as depicted in Raphael's paintings, we can conclude that Raphael, like some of the physicians and anatomists of the Renaissance and later, were keen observers of the physical condition. Surgeons, like artists, must be good observers. The growing interest in medical school curriculum and the use of art to train physicians and to become better observers is an auspicious sign that medical education is embracing a broader interpretation of learning beyond pure science. Using art to understand medical history and using medical history to understand art underlie the importance of the intellectual intersections of two seemingly unrelated disciplines. Perhaps the next time you visit museums, and there's some great ones in Chicago, you might view some endocrine abnormalities during your visits. Thank you very much for your interest. I just have two other slides just that they asked me to show. One is, some people don't know whether this is a man with gynecomastia or a woman with a beard, hirsute woman, and her husband. This is Madeline Ventura from Ribera painting. And this is Martha Zeiger, Wen Shen, and Aaron Felger's new book on the supreme triumph of the surgeon's art, a narrative history of endocrine surgery. And most of you recognize the one-horn rhino. Thank you very much for your attention.